Good evening, everyone. And counseling in clubfoot is a very important part of practice of a pediatric orthopedic surgeon. So let us consider three case scenarios. The first case scenario is when the ultrasound report has been reported as normal, but now the report has come out to be clubfoot and the mother is 30 weeks pregnant. The second case scenario is the mother is 18 weeks pregnant and they come to us with a report of clubfoot. So what should be done? And the third case scenario is when an ultrasound report has showed an isolated clubfoot deformity, but after birth, other congenital anomalies were seen. So the points that I will be discussing are the incidence, the family history, ultrasound diagnosis, what are the pitfalls, what is the classification system that is used, role of genetic tests, role of amniocentesis, treatment outline, and counseling tips, and finally motor milestones. So this is the first case. They did an ultrasound at 13 weeks, which showed a normal child and no clubfoot. When ultrasound was done at 23 weeks, the ultrasound was reported as left-sided clubfoot, and at 30 weeks, it was reported as bilateral clubfoot. Now parents were confused. So why was this happening? So let us see what are the problems in the diagnosis on ultrasound. So prenatal diagnosis of clubfoot has a false positive rate between 0% and 29%. And also if there are many cases where it has been diagnosed as clubfoot and it turns out to be negative. So the child did not have clubfoot. So always there is a chance either way. So optimal time to diagnose is between 14 to 16 weeks of gestation. This is because if you do ultrasound at a later date, there is a chance that it could be a positional clubfoot. Then the reasons for inaccuracies are sonographic technical factors, visibility of different gestational ages as already discussed, and dynamic factors. So 3D imaging may have a role in improving accuracy of diagnosis, and there is a 15 to 20% chance that diagnosis may change from moderate to severe and vice versa. And also it is important to remember that there is no relation of antenatal severity and severity grading after birth. So a lot of parents are concerned that on sonography it has been reported as severe clubfoot and then later on it turns out to be a mild or a moderate clubfoot. So this has got no correlation. So remember that. The commonest classification that is used on ultrasound is when the angle formed between the tibia and the foot, when it is 0 to 80 degrees, it is classified as mild. When it is 80 to 100 degrees, it is classified as moderate. And when it is more than 100 degrees, it is classified as severe. So as an orthopedic surgeon, what are the things that you should look out for in the ultrasound report? So you could remember it as A, B, C, D. So A for arthrogryposis, look in the sonography report whether the sonologist has mentioned whether active movements are present or not, active fetal movements, limb movements. B for back, that is spine, whether any congenital spinal anomaly, spina bifida or any other spinal anomaly is mentioned, whether there are any cardiac defects or other congenital anomalies like cleft palate, whether any dysplasias have been mentioned on the sonography report, whether there are urogenital abnormalities, or also some intelligent sonologists will also mention the status of the tibia or tibia hemimelia. So this is a child who had trisomy 18 and which was easily diagnosed on ultrasound. So now let us look at the syndromes and the detection rate on ultrasound. So you can see that the detection rate varies right from 50% to 98%. So, and the easiest trisomy is to diagnose is trisomy 18 and 13 because they have got lot of signs. So suppose if you have got a child who's already had a clubfoot, and what is the risk of the next child having clubfoot? So there is a 2.5% chance if it's a boy, and if a girl has a clubfoot, then there is a 6.5% chance that her next born sibling will be born with clubfoot. So if no parent is involved and it is just a random occurrence, that is 1 in 1,000. But if parents have a clubfoot, then their baby chance of having a clubfoot is between 20 to 30%. what are the genes that have been described in families? And the common genes are Hox gene and P1TX1 transcriptional pathway. But we did a study in Pune, and unfortunately, we were not able to find any gene. But yes, in India also, some genes have been described. So now let us look at the second case scenario. So the mother is 18 weeks pregnant and the report has come as bilateral clubfoot. There is no family history, and the risk factor that is there is the mother is 35 years old. So what are the blood markers that are advised, and what is the role of amniocentesis? In the first trimester, what the gynecologists are usually doing are the pregnancy associated plasma protein, the free beta HCG, and the nuchal translucency measurement by ultrasound. So this is the actual photo of the report that was given to the parents. So you can see over here, so they have mentioned that there is very low risk, but still there is a risk. So considering the age of the mother, we decided to do amniocentesis. So what are the indications for amniocentesis? So the indications for amniocentesis are if there is a previous history of termination, if there is advanced maternal age that is more than 35 years, if there is history of consanguineous marriage, or if there are abnormal maternal serum screen results. So in this family, we did amniocentesis and the report turned out to be negative. So what is the current consensus about amniocentesis? Amniocentesis, people say that it should be done because abnormal karyotypes in about 6% is seen in about 6%, and subtle associated malformations are detectable only later in the pregnancy. But those arguing again say that this percent is fairly small, and if the deformity is isolated and no other structural anomalies are detected, then amniocentesis is not recommended. So ideally, amniocentesis is not recommended in a lady who is less than 35 years with normal blood markers. Because amniocentesis also has its own risk, miscarriages, injury, and there are reports where having amniocentesis early is associated with increased risk of unborn baby developing clubfoot. And the limitations are that congenital myopathy can be missed. Some neuromuscular conditions can also be missed. So amniocentesis is also not foolproof. So now let us look at the third case scenario. Ultrasound was done at 20 weeks, showed bilateral clubfoot, did not mention anything about limb movements. Blood markers were negative, but an amniocentesis were not performed. And the child had all these deformities. So then what should we do? How should we counsel? Fortunately, we had fairly good result in this child, but I have seen children with normal sonography reports and having amniotic band syndrome, another child with syndactyly absent toes, another child with tuft of hair on the back, or this child which turned out to be a syndrome later on. So there is always a chance that some syndrome or some condition may be diagnosed after birth. So we have to tell the parents that we have an incomplete picture about this deformities, ectopathogenesis. It is completely treatable, manageable, and results that are obtained are excellent in literature, but you should not use the word curable. There are many centers in Pune and abroad and all over India which are trained in this treatment. Professor, don't ask them, don't become Professor Google. So a lot of parents do a lot of Googling, and on the net they will always find the worst case scenario. Very few people will put the best case scenario. So avoid doing a lot of Googling. Show them websites, support groups, ask them to meet other families. There are a lot of websites that the parents can see and Facebook pages. So we have to deal with emotions of parents. They can be widespread and unpredictable, and these are the various emotions of the parents that we'll have to face. So what to tell them about treatment? You can describe the Ponseti method. You can show them models about what actual clubfoot is. You can introduce them to other parents. Inform them about the cost and NGOs. Tell them that there are a lot of NGOs who will also do free treatment. So don't worry about the cost factor. And then the final question that all the parents ask is that, doctor, when will my child walk? Will my child walk normally? So we did a study on gross motor milestones in children, and we found that the child is likely to have a minor delay of 1 month in motor milestones, and that 95% of the children will walk by 18 months, and parents must adhere to plaster treatment protocol and brace protocol. And in unilateral clubfoot, the calf muscle on the affected leg can be smaller than the other side, and the leg of the affected side is often shorter than the other side. So these are the counseling tips, general tips which you can give to the parents. Thank you very much.